Hello coders. Welcome back to Avercode Medical Coding. In today's video, we'll be diving into the coding guidelines for sepsis and UTI. Understanding these distinctions is crucial in medical coding, as they each have specific codes and documentation requirements that affect billing and patient care. So, let's get into the details to ensure accurate and compliant coding. In today's topic, we'll explore whether we can code E.coli sepsis when E. coli is identified in a urinary tract infection. Sepsis and urinary tract infections, UTIs, are two distinct medical conditions, but they can be interconnected, especially if a UTI progresses to a severe infection. Here's a breakdown of the differences and connections between them. Sepsis is a life-threatening condition that occurs when the body's response to infection causes widespread inflammation, which can lead to tissue damage, organ failure, and even death. Sepsis can arise from various types of infections, including UTIs. A urinary tract infection is an infection in any part of the urinary system, which includes the kidneys, bladder, ureters, and urethra. UTIs are most commonly caused by bacteria, particularly Escherichia coli. Let's go over the coding guidelines. According to ICD-10-CM coding guidelines, coders should never assume a link between the UTI and sepsis without clear documentation. The provider must document that E. coli caused both the UTI and the sepsis, if applicable. Example 1. If the patient has both UTI and sepsis, and E. coli is the organism causing both conditions. Code A41.51 for E. coli sepsis and N39.0 for UTI. Example 2. If the patient has both UTI and sepsis, and E. coli is the organism causing sepsis. Code A41.51 for E. coli sepsis and N39.0 for UTI. Example 3. If the patient has both UTI and sepsis, and E. coli is the organism causing UTI. Code A41.9 for sepsis, N39.0 for UTI and B96.2 for E. coli organism. Example 4. If the patient has both UTI and sepsis is due to E. coli UTI. Code A41.51 for E. coli sepsis and N39.0 for UTI. Please refer the following coding clinic for the same scenario. Thanks for watching. Don't forget to subscribe for more coding guidelines and training videos.